A lot of you were enjoying a time outside this week, and some people are already feeling those seasonal allergies, you know, the itchy eyes, the sneezing, congestion, all of it. Joining us now is Dr. Brian Ewan, a physician at Innova Go Health Urgent Care. Doctor, it's so good to see you. Thanks for joining us. It is that time of year when, you know, we have to deal with those dreadful allergies. What is the situation now as far as folks coming to see you? Are you already seeing an uptick in patients?
We are actually, thanks for having me on. We are actually still seeing a lot of cold and flu symptoms and illnesses. Haven't quite seen allergies hit, but allergy season is already here. So a common misconception is that allergies start when you can actually see the plants and the flowers blooming. But usually, when the weather gets warm, this triggers pollen release from the plant, so you can actually start getting allergy season before before spring officially starts, which would actually be later this month.
Yeah, Chief Meteorologist Topper Shutt informing me that the levels are elevated now. I mean, I know personally I've been experiencing them, and I've been popping a little Zyrtec every day. But how do you tell the difference between allergies and a cold? Because you mentioned a cold. So, like, what are these symptoms to kind of know the difference?
Yes, so there are some symptom overlap, and it can be confusing, but there are some key differences. You know, when you get allergies, you get the runny nose, the scratchy eyes, itchy throat. Of course, colds can cause this too. Now, the difference is with colds, usually it's going to last about a week or so, and then you're going to get better. Whereas with allergies, it's going to be longer than that. It's going to be more persistent. And then, as you mentioned, with the pollen levels, usually with allergies, your symptoms can fluctuate depending on the pollen levels. That's one of the things that you can differentiate the two by. Another thing you can do is look out if you have fever, chills, body aches. Usually that's a sign of an infection versus allergies. Usually you're not going to get fever with allergy symptoms.
Okay, noted. You know, many people just typically grab something off the shelf, pharmacy shelf, and hope it works. What are some of the biggest mistakes that you see people make when treating seasonal allergies?
Well, at Innova Go Health Urgent Care, our top recommendation is to start early. Start on these medications before peak season arrives or before your symptoms peak. And usually what I mean by early is 1 to 2 weeks, like I said, before the peak. And then another mistake that we see is patients using these medications on an as needed basis. They really work best if you take it consistently every day. And some of the medications, like the steroid nasal sprays or the antihistamine nasal sprays, they actually take about a week to reach their full effectiveness, and you have to use it every day. So, like I said, you got to start early, 1 to 2 weeks before peak season, and then use it consistently every day.
Okay, that's an excellent tip. That's something practical we can do today going into the season. Dr. Brian Ewan, thank you so much for your insight and Innova Go Health Urgent Care. Thanks so much for your time and tips.
Yes, thank you for having me.
Of course.